All right, I think we can go ahead and get started. So good evening and welcome to everyone, especially to our residents and our student members. As part of the AMSSM MSIG, I'm very pleased to present to you a very outstanding lineup of AMSSM members who will be serving on our speaker panel today, including Dr. Bianca Edison, Dr. Stephanie Kliethermes, Dr. Christina Master, and Dr. Katherine Rizzoni. So how we'll proceed is I'll go ahead and introduce each of the speakers, and then the speakers will go ahead and present on their respective topics. I also encourage the speakers to share their journey on how they got involved in research and what topic area or areas they're passionate about with their research. And then while the speakers are presenting, for all the students and residents, please go ahead and if you have any questions, just drop them in the chat feature on Zoom, and then I'll go ahead and ask the speakers those questions at the end of their presentations. And then when we're done with all the presentations, we'll go ahead and have a general Q&A, just as another opportunity for you to ask more questions if you forgot prior. All right, so we'll go ahead and get started. Our first speaker is Dr. Katherine Rizzoni. Dr. Rizzoni is an associate professor of orthopedics and pediatrics at the University of Rochester Medical Center in Rochester, New York. She's the head team physician for the SUNY at Brockport Golden Eagles and also cares for the University of Rochester Yellow Jackets. She is a member of the AMSSM Research Committee and previously was head of the Grants Subcommittee, which is basically the group who awards the AMSSM grants. She helped coordinate the first AMSSM pre-conference on working on research questions and grant submissions at the 2021 National Conference, which is a great place for folks to come with research questions and to get input from AMSSM research leaders. So today, Dr. Rizzoni's presentation will be learning about different types of research project structures that are utilized. Dr. Rizzoni, whenever you're ready, you can go ahead.
Thanks for that great introduction. I'm going to share my slides, get into presenter mode. So again, thanks for having me, and this is recorded, so thanks for folks listening after this. So really happy to be a part of this. The panel is full of great folks, and I think you're going to find that there's a consistent theme, amongst and a lot of overlap between what we're saying. So my assigned area was to talk about different types of research projects. That's a picture of our junk drawer in our kitchen. So sometimes I feel like as you're trying to think about which research project to do, you're like, well, I have a lot of tools and I can MacGyver something, but it might be good to have a nice thought out process to say, hey, I'm going to use this tool specifically to answer this question. Just of note, my master's in public health was funded by the VA Quality Scholars Program, and I worked at the VA for a few years during fellowship. So I just want to express my appreciation to any veterans listening out there. We appreciate your service. So in terms of options, I think that during medical school and then also while you're in training, you're going to get hit over the head over and over again in terms of the different types of studies that are out there. We have systematic reviews, we have meta-analyses, there's randomized controlled trials, often referred to as RCTs. There's cohort studies, so you're following a population of interest. It's not a randomized controlled trial. You're actually just following it observationally, whether that's retrospectively, like looking historically, or prospectively following them from some time point into the future. There's also case control studies, and there's case series or case reports. And I thought this was pretty funny because now, I don't quite understand what meta is, but I thought that this is pretty funny because you could do a meta-analysis just by looking something up on Facebook now that's called meta. Sorry, lots of dad jokes today. So I hope most folks have probably seen some form of this figure in that we're talking about level of evidence. So at the top of the pyramid, and there should also, sorry, I should have written in meta-analyses here, are really the higher level types of research. And because you're taking a lot of, you could, in a systematic review, you could actually take a lot of RCTs or randomized controlled trials and summarize that data in terms of like, if you have a question, like get a bunch of great randomized controlled trials and see, if they answer your question in a certain way. We have randomized controlled trials. We have non-randomized controlled trials. So you can also have those. And then we have observational studies. So those would be your cohort studies, either prospective or retrospective. And then you have your case series and case reports, and then you have expert opinion. Now, one thing I want to say is that all of these are really valuable. Like, for example, HIV was discovered through a whole bunch of case series and case reports that were being published in the medical literature. There's a lot of different things, especially if they're rare or they're new. I mean, COVID was probably some case reports, you know, coming from cases out in the Pacific Northwest of some, in some living facilities with geriatric patients that they weren't sure what was going on. So it's, all levels are valuable, especially when you're a medical student or you're in residency. You're probably not gonna have the time, energy, or money in order to do randomized controlled trials, but you might be able to do a systematic review and learn a lot while you're doing it. So I just want to emphasize there are different levels. Each are important. Each can answer certain questions, and some, quite frankly, like for something really rare, a case series would be probably the most important design to pick. And I'm going to talk a little bit, like you might not be able to say which one is perfect, and it may, based off of your question, may change over time. Oops, sorry. I'm trying to get people in as well. Sorry, I'm getting the invites for adding people, so I'm doing that. Sorry, but there's more people. Okay, so in any case, I just want to emphasize there's all different levels. One thing I will also say is that as you start to read some of the research, oftentimes people are starting to report levels of evidence. So you can Google level of evidence, like JBJS started doing it, and in terms of just saying, like, for example, level of evidence 1 is actually a randomized controlled trial or a very highly rated systematic review. Now, I just wanted to bring up a couple other options. I'm not going to go into exactly in depth, you know, what all these entail, but just so that you're also keeping your eye out and your brain out for things, because sometimes these studies, which we talk less about, would actually be the most appropriate way to answer your question. So you have qualitative studies, you have either a cost analysis or an economic impact, and then you have quality improvement or implementation science, which is different than qualitative studies. So qualitative studies are where you're actually more engaging with your study participants. So rather than trying to get as many people as possible in a cohort, like thousands of people, you might be talking to like 6 people. And you're like, well, what are 6 people gonna, how valuable is that to get the input from 6 people? But you're getting like really in-depth information from those 6 people. And also you can do cognitive interviewing, where you might even be working with a participant one-on-one in terms of trying to figure out why, if there's certain behaviors or there's certain facilitators to barriers or facilitators to behaviors that they're doing. So small numbers, but also can be really important to answer certain questions. A cost-effective analysis or an economic impact, you might be looking at the different costs of medications, treatments, diagnostic studies. Quality improvement and implementation science has really become more popular in the past like decade or so. Fortunately, they're still not publishing as much with research studies using this type of methodology. But you know, when you enter residency and really throughout fellowship, you're probably going to be required as part of your curriculum to complete a quality improvement study. So you're looking at system level problems, you're looking at balance measures, like if you make one change like downstream that you think is going to be really helpful, you know, how does that affect the cost upstream? Like we've seen that a lot. For example, we want to COVID test all these people, but you have to have the supply chain to be able to get all those testing supplies. You have to have someone to actually perform those tests. And then you have to have a lab that's going to have the supplies to be able to actually analyze those tests. So we know what we want to do a lot of the time, but what are those balance measures that you're going to need to enact in order to answer that question? So how do you choose what type of study to do? I think this might end up being a persistent theme amongst what the rest of the speakers are saying. It really depends. It depends on what your question is. It depends on what your hypothesis is. It depends on how much money you have sometimes, because you know, if you want to do a randomized controlled trial, but you don't have any funding, it's probably going to be difficult to do it. It's possible, but it's going to be difficult. It depends on your expertise. Like I am not an expert in randomized controlled trials. And it just some people work very specifically in qualitative research or in quality improvement studies. So once you start to hone in and focus in on a certain area, you might end up doing a similar study over and over again, which is good because you get, you know, kind of the nuances and you get to become the expert in that. Who you're working with, you know, if your mentor is really focused on doing meta-analyses, you're probably going to learn how to do a good meta-analysis, which would be great. How much time you have, how much energy you have, because a lot of these things require a lot of time, and not just funding, but also like how much are you able to invest in that actual study? So who can help you determine the type of study that you should use? Well,
I'm going to try to find.
Your mentor can help you with that. As we discussed, not to try to advertise it for our own sake, but the fact is that we realize that a lot of either AMSSM members or people who are coming as learners to AMSSM had questions that they want to ask, really good research questions, and they may not have the background or the experience to know how to set that up as a research study. So hopefully you'll have an opportunity as a student or a resident to potentially come to and attend our national conference. And as a part of that, we have pre-conferences before the national conference, and there's stuff on economics and sports medicine, there's ultrasound courses. And one of the other courses we've added is to have some type of research question pre-conference, where if you wanted to bring a research question you had or a project that you were thinking about, you just weren't sure where to get started, you get an opportunity to meet with some of the research leaders of AMSSM and say, hey, give me feedback on this. Like, how would you go about doing this? What would be the best way to handle it? Your team can help you determine. So again, if you have a mentor who's really good at a certain type of methodology, I think that that's helpful because they can give that input of like, hey, I think you should go about it this way, or, actually you should take that question, maybe change it to use a study methodology. Your institution and your IRB board, your institutional review board. And I put an asterisk there, and I think Dr. Master is going to talk a little bit more about this, and that, you should look at the IRB as actually someone who can help you. Like, I think if you have a question about how it might be appropriately to do a study, you want to have your question first, but you can even call your IRB and say, hey, I'm thinking about this. Is this going to fly as this type of study? Because they could give background of other studies that they've seen and whether it'd be difficult to get that approved through the IRB or not. So you should always look at the IRB as your friend. So what I do is I see patients. I'm a co-investigator, like Dr. Edison is one of my co-investigators. I collaborate with people at the University of Rochester. Like, I collaborate with basic scientists looking at basic science tendon research. So do collaborate with bench scientists. I'm a principal investigator myself. I lead research projects either connected through AMSSM or at where I work at the University of Rochester. I'm a team physician. I get to educate, like tonight we get to educate, which I really enjoy doing. And then I get to advocate locally. So I just wanted to make the point that, even though you do research, you still get to do a lot of other different types of things. You don't have to necessarily hone in and just do research. So I think that's my 10 minutes. And I'm assuming we'll take questions afterwards.
Great. Thank you so much, Dr. Rizzoni. I don't see any questions at the moment, so we'll go ahead and keep going. And then any questions that pop up, I'll go ahead and ask you towards the end, if that's all right. All right, so next I have Dr. Christina Master. Dr. Master is a professor of clinical pediatrics at the University of Pennsylvania, Perelman School of Medicine, with 28 years of experience in clinical pediatrics at Children's Hospital of Philadelphia. Dr. Master completed her pediatric residency at CHOP in 1996 and served an additional year as chief resident. After 14 years with the residency program as vice program director, she took a sabbatical year to complete sports medicine fellowship at the Hospital of the University of Pennsylvania and returned to help start the sports medicine fellowship at CHOP. She is board certified in pediatrics, sports medicine, as well as brain injury medicine, and is a fellow of the American College of Sports Medicine. She treats over 800 youth with concussion annually in her outpatient practice. She is a co-founding director of the Minds Matter Concussion Program, a frontier program at the Children's Hospital of Philadelphia. The program provides clinical care, community outreach, and conducts research in youth concussion. Her particular research emphasis has been in furthering our understanding of visual deficits following concussion as a target for intervention for those with prolonged symptoms, in addition to identifying objective physiologic biomarkers for concussion with the goal of improving diagnosis and treatment of concussion and prevent the development of persistent post-concussion symptoms. She also continues her general pediatric primary care practice that started with community clinic in residency at the 39th Street site, which is now part of the Karabat Center in the CHOP Care Network. Dr. Christina Master will be presenting today on tips on writing a proposal and getting IRBs. Dr. Master, whenever you're ready.
Great, thanks so much, Sonal. So sorry that bio was so long. So that just shows you how old I am. That's really all it means. So anyways, some tips on writing a proposal and getting IRBs. And this, I think, follows nicely Katie's talk. Basically, let's see if I can get this to work here. Why are we doing this again? And, we're going to have a bunch of, minion memes today because that was just really how I was going to get through the day today. So Why do we do research? To generate some new knowledge, to answer some questions that maybe nobody has the answers to. Maybe you're doing it because you have a burning question and hopefully it's based on your clinical experience. Or maybe you just have a general area of interest and you're just looking for a good question. And so that's sort of, I think the backdrop, that we're going to be working on. I think it's important to realize that if you're going to dive into this, you're going to do some homework and you're going to want to do that homework because it'll help you as you're going through and setting up your research project and hopefully executing it and seeing it through to the end. And so you want to make sure, what do we already know about that topic? You don't want to waste your time. You don't want to answer a question that someone just answered and just published, last month. Although you may want to replicate findings. And so I think that's actually probably underrated, how important it is to replicate findings. It may work well in one setting, but that's an example, would be that John Letty always talks about how exercise works in Buffalo, but until we did the multi-center trial that was supported by AMSSM, where we also did it at CHOP in Boston, he wasn't really sure if it worked anywhere else except Buffalo in terms of exercise after concussion. So you want to replicate, you want to expand on current findings. Those are all good goals to have. So what do you not know and what can you contribute? We want to generate the new knowledge, expand on the knowledge, new clinical applications or new settings. And then finally, it's got to, I think, probably pass a little bit of the who cares criteria. Is it clinically relevant? Is it going to have an impact on patients and their quality of life or outcomes? I think that's the kind of research that we do, right? So we're not basic scientists that the NIH is funding to help us necessarily understand all of the ins and outs of the underlying physiology of problems. Maybe that's part of it, but that's not going to be entirely it. We're going to really want to have some kind of impact on patients and outcomes. And so kind of try to always have that as your, long-term vision in terms of where you're trying to head with answering a question. And then, what the homework ends up being in this step really is do a thorough review of the literature. And so, as Katie mentioned, systematic reviews are really like the top of the heap in terms of quality of evidence. Those are hard to do, and you're definitely going to need to have some mentoring to do that. But if you are ambitious and that's something you want to do in terms of, trying to understand your field to be able to set the stage for your study, then, go for it. Otherwise, there are definitely other ways of doing it where you can do a scoping review where you just kind of like do like a 30,000 foot view of your topic to try and see what's out there. Or a narrative review may drill down a little bit deeper than a scoping review, but maybe is not quite as rigorous as a systematic review. And, whenever you see someone who's published a review, you can bet that that author and that group is probably working on some research project that they're building up to. So this is actually a really good step to go through. It's a nice rigorous step to go through and you could get a publication out of it. And it helps set the stage for a really well thought out research project. So consider that, as a potential option as a pre-step to your research project. The next thing I think that's really important is refine your question. Just like Katie had said, your question is really so important. And I think we kind of have to remember, there is the question that you're asking that's clinical. And, in my particular, area of obsession with concussion, it might be something like, well, how do younger kids do with concussion? Do they do worse? Do they do better? Do they do the same as teenagers or older, patients? But the question is probably a little bit different from what your hypothesis is, right? And so I think the hypothesis is really important in terms of making sure that you really actually drill down to something really precise. You want to really be clear about exactly what you're trying to accomplish. And then you want to actually get to the point where you actually commit. You're going to, have done your homework and a little bit about the background. And are you going to commit and say, well, little kids take longer to get better from concussion, or maybe they don't take longer. But you can't hedge when you're doing your hypothesis. You've really got to pick one or the other because you're going to design your study. And Stephanie is going to kind of go through that with us in terms of like how you're going to approach, proving your null hypothesis if that's going to be your goal, rejecting the null. So you got to commit. And then it's got to be testable. We want to be able to come up with an answer with whatever the hypothesis is, the approach that we take. So it takes a little bit of an additional step beyond just having the curiosity and the question to generating the hypothesis. But spending a little time there, talking with your advisor or your mentor on this is going to be time well spent, because a well-designed hypothesis really will get you where you want to go, because everything flows from that. The study design, what you choose, like Katie had indicated, what are the methods, what are the statistical analyses, and really it's all in the question, okay? Writing your IRB protocol. And this is sort of actually, when you look at this, I want you to think about this as actually sort of similar, not exactly the same, slightly different, but really analogous to what you would be doing if you are writing, your review, your lit review, writing an abstract that sort of describes what your, question, your project's going to be. Or even putting together the skeletal frame of your ultimate manuscript or paper. If you do a really, really good job designing your question, your hypothesis, you'll actually have most of your background and potentially some of your discussion written. And then you sit down with your, statistician, and you go through methods and analysis, and you're going to revise things, because obviously things are not going to come out exactly the way you think, and you're going to update your background because again, things will change after you've done your study. But if you've done your homework, you've got all the elements of a framework for your manuscript there, and so your IRB, your manuscript, your draft, is all the pieces, parts are there. And so I think about that as time well spent and invested. So from that perspective, your IRB protocol, slightly different angle than a draft manuscript, but again, the work that you do will pay off in the end for sure. One thing that I would definitely recommend everybody get in the habit of using are these research planning checklists. And so the Equator website is one that's good to kind of like, bookmark and check out, because basically it has like a whole host of different planning checklists for whatever study design you're interested in doing. There are a lot of journals now that require you to actually report what you did in terms of planning when you publish. And so rather than kind of going backwards and doing it after the fact, always better to plan in advance and do this. And so you can see the STROBE checklist is for observational studies, and that's probably where most of us all start out. The CONSORT is for trials that are prospective clinical trials, and then the SPIRIT are specifically for interventional trials. And so you can see they actually are really helpful, not only for reporting what you did, but for helping you plan. And it makes sure that you're really systematic and really have, sort of a high level of, planning in terms of making sure that you've considered all of the ins and outs of the study that you're trying to put together. Part of these planning checklists usually involves a flow diagram. And this flow diagram, again, extremely helpful, time well spent, both in terms of planning your study, writing your protocol, and ending up being probably, your, figure or figure two in your manuscript. You want your readers, and reviewers of a manuscript or your IRB to kind of know what you're thinking in terms of, where's your cohort coming from? What are the eligibility or inclusion or exclusion criteria? What's the process flow for, actually moving through the study once you've consented? And so all of these things, are really helpful. And sometimes, as we'll often say, a flow diagram or a picture is worth 1,000 words. And since you got word limits on your manuscript, that's always helpful. And then when it comes to statisticians, they are going to be, your best friend. None of us do this alone, and very few of us do all of our own statistics. And I certainly do not. And so this is a really short slide because all I'm going to tell you is consult a statistician. Basically, your background literature review is going to be really helpful because it's going to give you an idea of what's known, what's not known. It'll help you get some numbers that you can essentially think about what the effect sizes are that you're trying to detect, and then your statistician can help you work a little mathematical magic and figure out your sample size and power, and then you're off and running. Obviously, a lot of you are going to have some really great basic fundamental skills in terms of doing some sample size and power calculations, and absolutely go ahead and do that, but always run that by someone who's got a little bit more experience, because it'll just save you from a lot of minefields down the line. Always better to forward engineer rather than reverse engineer. You're going to have to decide on what your primary and secondary outcomes are. And this is, again, where discipline is really important. You can't answer every question, so you got to pick. Just like you had to commit on your hypothesis, you got to pick on your outcomes. Maybe you'll have a secondary one, but, you got to pick on the primary. And then, talk with your statistician about the best analytic approach. It might be straightforward. Maybe there's a little bit more complicated way that you can approach it. So definitely pick their brain. With regard to IRB, sort of just in terms of the standard protocol, structure, they're not rocket science. They're also not the time for you to get creative. This is not creative writing. Pretty much, it's like, I tell my kids with regard to school, school's got a lot of rules, and it's the rules of the game, and figure out how to win the game. That's basically it. And so with the IRB, there should be a roadmap, a pretty standard roadmap, and you should follow it. Definitely look to mentors, colleagues, if there's sample IRBs that you can look at. A lot of IRBs actually post them on their website, so you can look at them and map after them. And just, don't get creative. Just, follow it to the letter of the law, and you'll be good to go. And it'll get you really far in your first pass for sure. And then I think lastly, what I would say is make friends with your IRB analyst, your friendly neighborhood IRB analyst. Gets kind of lonely, I think, actually sometimes. And so they love your questions. I think they actually crave interpersonal interaction, because, people kind of tend to malign them and give them a bad name. And so there's no question that's too dumb. They're actually so lovely. And they just are happy to answer any question. Pick up the phone, send an email, meet them in person. And actually, most of them have IRB office hours, just drop in, and so that helps you figure out the process. I think there's something that you'll realize about the way that the IRB committee thinks and approaches questions that is slightly different from just designing a research study. They are looking to protect, human subjects. And so they have a slightly different angle and slant to it. And then you'll get a sense for, what's the timing, how far advanced you need to get something in, what's the approach, what are the common questions that they're going to come back to you with that you can start to anticipate, so you don't have to have so many revisions and stipulations when they come back to you. And then if you get to know them, they can be really, really helpful when you get really desperate and you have something that you got to get quick under the wire. So make friends there, and your IRB analysts will be a big help in bailing you out in a pinch. So we'll leave it at that and go on.
Great. Thank you, Dr. Master, for that informative presentation. I don't see any current questions. So just a reminder to the students and residents, don't be shy. Please go ahead and ask any questions you have. After our speakers finish speaking, they can answer them right away. We'll also have a time at the end as well. So I'll go ahead and move on now to Dr. Stephanie Kliethermes. Dr. Kliethermes is the research director for the American Medical Society for Sports Medicine and an assistant professor in the Department of Orthopedics and Rehabilitation at the University of Wisconsin-Madison. As AMSSM Research Director, she oversees and advances the research initiatives of AMSSM, including the Collaborative Research Network. With her PhD in biostatistics, Dr. Kliethermes' research focuses on the application of statistical methodology and design to sports medicine. While she oversees a broad portfolio of AMSSM research interests, Dr. Kliethermes has particular research interests in youth sports specialization and running, biomechanics, and injury risk in athletes. Dr. Kliethermes today will be presenting on basic stats that are utilized in sports medicine research. Dr. Kliethermes, whenever you're ready, you can go ahead and start.
Sorry, I couldn't find my unmute button. It's usually on the bottom and it was at the top. So I'm good to go. It's late. So we'll just chalk it up to that. Thanks so much for that introduction. It's an honor and privilege to be here to talk with all of you tonight and those who are tuning in after the fact. And I just want to give a shout out to my panelists tonight, because they are very talented researchers that I get to work with on a regular basis, and it's really such a privilege to do that. And each of them are actually AMSSM grant award winners, and so I think that that's really important for you all to know, because AMSSM does give a ton of different grant opportunities to help you conduct research, both from a young investigator all the way up to a multi-site, 6-digit grant award. So these are really top-notch researchers within our organization. So it's really an honor to be here. So as Sonal said, I'm not a clinician. I am a biostatistician, so I'm a little biased in the role that biostatisticians play in research. I think we are essential to the research process, and so I'm grateful for my colleagues who are affirming that tonight, and assuming or saying that we're a valuable member of the team. And I'm actually going to take a little bit of a right turn here. When I first graduated from my program and from training and started as a biostatistician, I was all about giving the talk of, this is the statistical test you should use in this situation. And I very quickly veered away from that because I learned that every study is different. And so you can't just take what's been done before and replicate the stats and assume it'll fit with your study. And so I really hesitate to tell you, these are the stats that you need to do in this situation. And, there are a ton of flowcharts out there that you can follow. And I'll tell you, a lot of the times they take you to the wrong answer. So I think it's really important to kind of throw those away. And as Dr. Master was saying, talk to your statistician, because I think we can set you on the right path. So I'm really going to talk more about statistical literacy today, as opposed to really some of the statistical tests that I think you need to know. And so case in point, I love to kind of do this little exercise, and I refresh it every year, but if you go to any of our top medical journals in sports medicine, this one I chose the British Journal of Sports Medicine, and all I did is I looked at the original research articles, so there were 4 or 5 of them in this particular issue from this summer, and I just pulled out the different stats that the investigators used. And you don't see things like a t-test or a chi-square test that you might be used to or you might have heard before. There are some things in here that you may have heard about, z-scores or prevalence or a median and IQR. And I think some of those basic things are really important for you to kind of have a general grasp of. But then there is a ton of different types of stats that some of you may have heard of, and you may have I have no idea what it means. So like a Dear-Simonian and Laird test, which is a random effects model, is for meta-analysis. So you may have heard of that. You may not have heard of that. Principal component analysis, you may say, oh, I've heard of that. I have no idea what it is and why I would use it. And then there's certainly a ton of things on this page that I think you've probably never heard of, right? Have you heard of the Akaike information criteria, Cochrane's Q, the Bagh-Mazumdar calculation, and Egger's tests? So there's all these different tests that I think they're used for a very specific reason, and they're obviously used in sports medicine because this is our top sports medicine journal. And so I can't teach you all of these tests, but I can help you learn what tests you should do with your specific research question. And so that's kind of why I'm going to kind of take a right turn here. So what do I think you need to know? I think it's really important to know your data. And this is where I think that I talk a lot about statistical literacy. So can you talk about what your data looks like? And that starts with kind of being able to summarize the variables that you want to collect or that are in your data set, and being able to describe them in such a way that we can then go on and choose an appropriate statistical analysis. So I want you to be able to know, is it a continuous variable? What does a continuous variable mean? Or is it interval or ordinal? So is there some sort of count or level to it, but it's not quite continuous that you can put it on a number line? Or is it a categorical variable that's binary or nominal? So binary would be a yes or no. We see that a lot in sports medicine. Do you have a concussion or do you not? Are you injured or are you not? Nominal has no order, so there's multiple levels to it, but there's no order. So you've learned this. Many of you learned this for the first time in 3rd grade, right? And then you've kind of, it's grown with you. But these are the types of things that you really need to have a solid grasp of, because when you work with a statistician, how your data is collected and distributed is really going to determine the statistical tests that we use. Another big concept in statistics is variability. If you don't have variability, we don't do statistics, right? So it's really important to be able to, what statistics tries to do is it tries to explain the variability and why there are differences between different people and different groups of people. And so it's an essential component of statistics and of research, but at the same time, if you have too much variability, we can't answer your question. And so it's a really kind of an important balancing act. And this is why we do things like sample size calculations to really try and get a sense of what's the sample size we need that's going to give us enough variability so that we can have enough data to answer our question, but not too much variability if we don't have a big enough sample size that we can't answer our question. And so I think that understanding the role of variability and why people are different in your data set or why certain variables look different, I think is really important. And so how do we measure variability? We measure variability using standard deviations, standard errors, confidence intervals, variances. And so these are probably terms that you've heard about before. And these are things that you really want to kind of have a general understanding of because they're telling you about the spread of your data and how variable your variables are. And so if they're if there's a big standard deviation or a big standard error, you're going to need a larger sample size to be able to answer the questions you want to know. But if there's a smaller standard deviation or a smaller sense of variability within the data that you're collecting, then a smaller sample size will be just fine. And so I think the concept of variability is another one that is really important for you as a clinician scientist to be able to understand when you're working with a statistician and kind of trying to figure out how to progress your research project. And then there are just really important things that you need to know about how you are collecting your data. And this may not seem like a statistical problem, but so much of how your data is collected goes into how we analyze that data. So we need to know how you actually gather the information. For example, if you're doing a study on obesity, let's say, and you're collecting weight, okay? So do you ask the patient what their weight is, or do you put them on a scale? If you ask a patient what their weight is, there's probably going to be some measurement in there, right? I think people are not always that great about judging their weight, or they just don't want to share what their weight is. But if you put them on a scale, that's going to probably give you a more accurate estimate of what their weight is. So I think it's important to understand how those variables are collected and if there's some measurement error that could be included in the data that you've collected. And how did you sample your population? Did you just go and ask your friends to be part of your study? Or did you do a randomized trial? Or did you do a convenience sample for people that just kind of came into your clinic? As they were talking about earlier, I can't remember if it was Dr. Master or Dr. Rizzoni, but I think it was Dr. Master was saying, Dr. Letty did a study on concussion and he just did a single site study, right? But if you expand that to multiple sites, that gives you more generalizable information. So that's a sampling strategy that they employed to try and get more accurate or better information. It's important to know how you determined your sample size. So did you actually calculate the sample size you needed to answer your question? Or did you just use everyone that you had available and the time and resources you had available? I think the latter is probably more common, but there are problems with that because then we result in a lot of underpowered studies that result in null findings and that may or may not be accurate. Missing data is big in human research and biostatistics and clinical research because you're dealing with patients who may not come back or may not respond to surveys, and you just have missing data. And so it's important to know why that data is missing, how much is missing, what you think the reasons are for individuals that may be missing, because we can account for that in our analysis, and we really need to account for that in our analysis. And then you need to know, is your data independent? So this is a big buzzword in statistics, right? If you have repeated variables, if you see a patient for monthly, they're recovering from concussion, and you see them at their initial visit, and then you see them as they're recovering, then all those time points that you collect data on the same person, those aren't independent time points, right? Because they're coming from the same person. And so we have to use statistics to account for that. And so it's really important to have an understanding of that type of data as well. And then lastly, what type of variables do you need to collect to answer your questions? Are you missing anything that could be confounding the relationship that you're trying to assess. So you're not just going to collect your primary outcome variable and your primary potential predictor. You need to then think about other variables that could be important, such as race or sex or age. There are so many different variables that we think about that could confound relationships. And so all of this kind of goes into your data collection and are really important when you're considering to do statistical analysis. And this is like, this is the tough one, p-values, right? So p-values are often put on a pedestal in statistics, and they're the end-all be-all because everyone wants to find a p-value that's less than 0.05. But what does that really mean, right? I think we don't have a very good understanding as a scientific community of what p-values are. And I think that hurts us because a lot of people just think if we can get to that p less than 0.05 threshold, then we're golden. But statistics isn't really like that, and research isn't like that. It isn't black and white that on one side of that threshold, you all of a sudden have a significant relationship or you found a significant finding, and then on the other side of that 0.05 threshold, there's absolutely no significance. And I think that stems from the fact that we really just don't have a good understanding of p-values. And I will put some of that blame on my field that we don't do a good job of explaining what p-values are. And so I put the definition here because it's a very confusing definition, right? The definition of a p-value, the true definition, it's the probability, given there is no true effect or difference, of collecting data that shows a difference equal to or more extreme than what you actually observed. So some of your minds might be like, well, what does that even mean, right? And so I think that that's really, it's a concept that I talk a lot about when I'm teaching statistics or when I'm talking with clinicians, because we really need to understand what that p-value is telling us in order to then be able to make appropriate conclusions and inferences from our data. So I think just some important takeaways is that, a p-value of 0.04, yes, that would tell you have found a statistically significant result. But a p-value of 0.06 in my mind is the exact same thing as a p-value of 0.04. And so there's really no difference, even though you're on either side of this 0.05 arbitrary threshold that just a statistician made up 100 years ago was the right threshold that we should use to determine if there's significance in our findings. So I think I think p-values are going to constantly be this point of discussion, but are very important to statistics, but there's much more to the context of a p-value as well. And so when you're thinking about research and not doing your own research, but also reading research, I want you to think about not just the p-value, but look at your confidence intervals, how variable your results are, the strength of the effect that you found. There's a lot of different components that kind of go into that. And a statistician, if they're a member of your team, can help you really interpret some of those results. So what can a biostatistician help you with? Well, we can help with quite a few different things. So Dr. Rizzoni was talking about the study designs earlier today. We can help you determine the appropriate study design based on your research question, certainly calculate appropriate sample sizes, choose the correct tests, and actually run that analysis. We can give you advice on handling different nuances that are specific to your data. And so some of that might be you have repeated measures, you have missing data, you have some censored observations, or you're working with specific subgroups and you don't really know how to handle them. We can help you interpret your results. And then which my colleagues love the most is that we'll help you write the statistical sections of your grants and your reports and your manuscripts and presentations and make sure that you're saying things in a kosher way. So we really do kind of come into play from the very beginning of a research project all the way to the very end. I think can be having a statistician can be very helpful. So then the next question I get is, well, how do I find a biostatistician? It seems impossible, like trying to find a needle in a haystack. And that can be true, right? I think there's a high demand for statisticians because statistics is really required in so much of research now. And there's just not enough of us to go around at this point, especially in sports medicine. There are a lot of statisticians in pharmaceuticals and in different sectors, but really in our area, there's is a little bit of a paucity. So where can you look? If you're at an academic institution, I would encourage you to seek out statisticians who might be interested in collaborating that are in the statistics or biostats departments. Most large, if you're at a large research institution, they have what are called CTSA programs. These are programs that are funded by the NIH. They may not go by the name CTSA. Here at UW-Madison, it's called ICTR, and I know that there's different names for them all across the board, which is super confusing, but these are NIH-funded programs that house statisticians that can help you with your research. If you're not at an academic institution, usually you're going to go try and find a consulting center or a consulting firm. That usually comes with a cost, so just be aware of that you probably will have to put up some funds for a statistician for that. And then word of mouth from colleagues. So if you have a mentor, if you have a colleague that does a lot of research, they probably have a statistician that they work with. And so ask them, who do you work with? Do you mind, if I reach out or get their contact information to see if they could help me or push me on the right track? And, we're always happy to kind of, to respond to those types of inquiries as well. So just a few last points for you. I think statistical literacy is more important than knowing what test to use when, right? And so statistical literacy is knowing your data and knowing how to describe your data appropriately. I think that's really important. And understanding those types of concepts, basic concepts, so not necessarily tests, but just means and medians and continuous and categorical data is not only important for conducting research, but also when you're reading research as well, right? Because it's really, you need to be able to assess how well that research study was done. And so having that basic understanding is going to be really valuable and important. I know I am biased, but I always put this point in that I think you should consult with a biostatistician on statistics and design. And I say when appropriate because, as Dr. Master pointed out earlier, there are some clinician scientists who know a lot about stats, and so you can get by. But I would say that a majority of my colleagues, they would much rather prefer me do it, and they just feel more comfortable with me doing it than them trying to do it and them banging their head against the computer when it's not giving them, they're getting error messages and it's not making sense. And so I think if you can find a good biostatistician, that certainly will help you in the long run. Then finally, I think research is just like a team sport. I think you are more successful when you have others that are around you and you're all working together. And so you all have different strengths. I was a volleyball player in college, and I was the libero. I was not the one up in the front row blocking or, hitting, making kills and stuff, but I was an important contributor to that team, even though I was not in the limelight, right? And so I think research is a lot of the same way that, there's the PI, but then there's the supporting cast, and that includes the regulatory cast that the IRB specialists and analysts and your grant personnel and administrators, your statisticians that are really going to help you make research successful. So I think one of the biggest misnomers that that new researchers think is that they have to do this all themselves. And that's just not true, right? You really need to find that team and let people help you, and that will lead to a successful research project. So that's all I have for you from a statistical point tonight.
Great. Thank you again for all that applicable information and also for educating us on the very elusive p-value. So we really appreciate it. We'll go ahead and move along to our final esteemed speaker, Dr. Bianca Edison. Dr. Edison is a sports medicine attending physician in the Children's Orthopedic Center at Children's Hospital Los Angeles, CHLA, and is assistant clinical professor of orthopedics at the Keck School of Medicine of the University of Southern California. After her undergraduate training at Harvard University and graduate training at Bocconi University in Milan, Italy, she attended Baylor College of Medicine and afterwards completed her residency in pediatrics at UCLA, go Bruins, at which she served as chief resident. She received her subspecialty fellowship training in sports medicine and orthopedics at CHLA. She's part of the sports medicine program at CHLA. In her practice, she sees and helps treat injuries unique to young children, adolescents, and young adult athletes in organized and recreational sports and everything in between. She works closely with her patient athletes to optimize safe sport participation and minimize the time away from their respective sport. Her specialized areas of expertise include dance injuries, sports-related concussion, injury prevention, overuse injuries, access to sports, and biomechanical analysis. She brings a personal understanding to the challenges facing young athletes, as she grew up as an athlete with a passion for sports. Today, Dr. Edison will present on why every sports medicine physician needs to understand research and how to get involved in a research project and study. Dr. Edison, whenever you're ready.
All right, thank you so much for the introduction, and thank you to everybody who's listening tonight. Let me get this. All right, so why do we need to do research? Why do we need to even care about this? So really, the main aims of research include gathering knowledge or evidence for theories or ideas, informing action, building on current knowledge in a particular field. And there's a saying that complacency, inertia, and compromise are the exact ingredients for death. And I agree with that. And it's really important to understand that research, although it might seem like a no-brainer, many people try and avoid it like the plague, but we shouldn't. And especially in sports medicine, we should understand that is just as critical for us as in other fields. And it's really imperative for us to be able to move forward and help our patient populations as much as possible. And so being a physician in today's time involves a career of lifelong learning. And the medical care that we enjoy today is built upon years of tremendous effort from scientists, investigators, physicians, and other medical professionals investigating causes and potential treatments for disease. But there's a lot of work that still needs to be done. And what we know now and how we conduct and deliver and provide care is going to be dramatically different 25 to 50 years down the road. Which can be daunting to some, but conversely, it can be really exciting because we can be involved in that cutting edge research in those projects. And by doing research and participating in those scholarly activities, then we can gain insight into how diseases progress, how preventative medicine can be implemented, what to do in regards to creating differential diagnoses. And it's really important in that it can help patients and society at large benefit in a positive way. And it can serve as a concrete vehicle through which one can really, you get the opportunity to really sit and dream and think of ideas and think of what is lacking in certain fields. And then as Dr. Rizzoni and Dr. Master talked about, really hone those into a focused question and then organize and develop those into a succinct plan to test that hypothesis, record what you do, analyze that information, and then effectively communicate that data to a larger audience. And so that mindset to always stay curious and continually work on an idea can help you build. It leads to a lot of opportunities to engage with others and really work on a common idea or thought that then can lead to real transformative work that then pushes a certain field further. And so involvement in medical research has been found to improve clinical practice, and those research active healthcare providers help to achieve better patient outcomes. It's been shown in studies. So why do we need to do it in sports medicine? That's no exception to the need for this research. And prior research has shown that an active body has tremendous long-term benefits from a health and a physical, cognitive, emotional, and a productivity lens. And so prior research from the CDC has also revealed that from about 2011 to 2016, there were just shy of 9 million sports and recreational related injuries in the US. And in youth, from 5 to 18 years of age, one athlete gets hurt every 25 seconds and goes and gets seen in the ER for such. So it's really important that we're part of that research to look at what is going on in our active and athlete communities. help us understand the injury processes that are happening, how certain health conditions may predispose someone to a certain injury. Are there certain comorbid conditions that are occurring that might keep them injured on and off the field? How different movement patterns can help or harm us, and how what we do on a regular basis, such as what we put in our bodies from a nutritional aspect, what we drink, how we sleep, can really affect sports performance. So all of these things can help provide sports healthcare providers with a real arsenal of information to best support an athlete and our patient populations. So does research affect change? And the answer is yes. I could spend a good 2 hours talking about how certain ideas and innovations have really helped further our scientific field, and in particular in sports medicine. So in the late 1950s, the concept of telehealth and telemedicine came about because there were a lot of patients in the psychiatric wards that really weren't getting the proper care and treatment that they needed. So there was a center in Iowa that was connecting to another center in Ohio that helped connect those healthcare practitioners to talk about best practices and how to best support those patients. In the 1960s, measles, the vaccine was discovered. And so it has helped eradicate, well, hopefully still, this disease process. In 1965, the first portable defibrillator was invented, and that has really helped us to provide some life-saving care on the field where an athlete, someone who's active, suddenly drops down during an athletic event. In 1980s, the invention of the suture anchor came about. And so that's really helped transform how orthopedic surgeons and other surgeons conduct certain procedures, and has decreased the amount of time and the recovery time for certain procedures. In 2003, Human Genome Project was mapped. That has really helped identify certain disease processes and hone that in on a particular gene and help create some gene therapy to decrease the prevalence of that. 2009, Zachary Lystad law came about and has now been implemented in all 50 states in this country to really help with concussion management and prevent sudden impact syndrome. Just like Dr. Master talked about, some really important research came about to show that sub-threshold exercise during the time of concussion recovery is super important, and that helps decrease that time, as opposed to what we used to do, a cocoon therapy, and tell someone to just go into a dark room and wait it out. And so now we're on the verges of yet some more research in the COVID-19 vaccine during this pandemic. So much research helps transform the way we provide and deliver care to our communities. So on the flip side, can research harm? And the answer to that is yes. And so that's why it's so important, like Dr. Kliethermes was talking about, in how to recognize good research. How do we critically analyze research that has been done? Is it good? Should it be transforming or informing the way that we treat patients? So there have been a lot of instances of research that's failed to interrogate racism as a critical driver of racial health inequities. And there's really no uniform practice regarding the use of race as a study variable right now. And so when certain research studies are conducted that has race revolve around a biological construct, and that it creates that as an innate and permanent and inescapable status that really harms the way that we care for our patients. And these practices can lead to unfounded statements about traits that are attributed to certain ethnic minorities without really acknowledging systemic influence that racism and inequities can have on certain outcomes. So certain examples, the ill effects of Dr. Thomas Hamilton, who tried to use really skewed research practices to determine the thickness of Black skin, have carried through to modern times. So in a study published in 2016, 40% of first and second year medical students endorse the belief that Black people's skin is thicker than white people's, and believe that Black patients therefore don't feel pain as intensely. And so a meta-analysis then showed that looking at pain in numerous settings found that African-American patients were over 20% less likely than white patients to receive pain medication for certain conditions, to include postoperative care. So we really need to be able to look at research in a critical way, involve ourselves in research in terms of constructing it in a critical and well thought out way, so that we can help our patient populations as best as we can. So that really underscores the importance of research being done and being included in a peer-reviewed process before it is published. And that means that when an individual publishes research, it's fact-checked, it's investigated for common biases, it's looked for statistical errors, and really methodological issues by others in that field before being shared with the scientific community at large. And so it still remains a flawed process, but we're improving over time. And that's why it's important for all of us to really educate ourselves and be involved in this process so we can make it as robust as we can. So what can you do? What can we do? Is get involved. So really learn the fundamentals of good research. What is good research design? What statistics are really important when you're looking at a particular research project? Look at the ways to critically appraise the current research that's out there. And then seek out those opportunities for research involvement. That really helps to lead to mentorship opportunities, collaborations. Again, like Dr. Kliethermes mentioned, you do not have to do it alone. It really is a team effort. It involves a lot of different people coming together, sharing ideas, help improve each other and the process so you can deliver a really good product and good information for that community. And really take time to reflect on what your interests are, because that's important. You don't want to just throw yourself into a project that you're kind of lukewarm about the subject matter, because then you're not going to put in your full effort. Certain percentage of effort in leads to a certain percent of a product out. And then really stay curious. It's so important. Sports medicine is a relatively new field. And so that's what makes it so exciting. There's a lot of stuff to really uncover and learn still in terms of how we can best help support our patient athletes and our active community, and look at trends and really help elevate it to the next level. So with that, I'll leave that and we can open it up for questions.
Thank you so much, Dr. Edison. And I know I don't just speak for myself, but for everyone who's tuned in today. We could probably sit here for hours and listen to you guys teach us and learn from you. I know we've run up to the end of our session. I don't currently see any questions in the chat. So I'll go ahead and just briefly open the floor. If anyone has any last comments, you can go ahead and tell us now, or we can go ahead and conclude. So any last words of advice, comments from any of our speakers?
I would just rehash Dr. Rizzoni's point that, if you're interested in getting involved in research, the AMSSM pre-conference is really meant for junior investigators that are trying to get started. So if you want to continue the discussions that we started today and more in-depth conversations with us, we'll all be at that research pre-conference, I believe, but also other researchers, I really encourage you to look into that because it's a great opportunity.
Perfect, great, thank you again. A gigantic thank you to our entire speaker panel for their insightful presentations and really just for sharing the evening with us. We really appreciate it. I'd also like to thank all the residents and students who were able to make it out today And thank you to all the future students and residents who will be viewing this. This webinar has been recorded and it will be posted on the AMSSM YouTube channel and on the student page of the AMSSM website. So you can view it at your leisure. Some last minute things for some upcoming events that the MSIG has planned. Our next webinar is next Wednesday, November 17th, 8 p.m. Central Time. It's going to be a 6-member panel on Olympics and Paralympics. So definitely stay tuned for that one. And then also this Sunday, November 14th at 4 p.m. Central Time, we're going to have our first ever AMSSM MSIG Virtual Trivia Bowl for the student members and the medical school interest groups. So you can compete for prizes in all the rounds. And this is basically a great way for the fellow medical students to engage and get to know each other and, you know, just learn and find out about students who are just as enthusiastic about sports medicine as you. So you've got to play to win. So definitely register now and we all hope to see you there. Other than that, have a great night and happy Veterans Day tomorrow. Thank you again.
Thanks so much. Bye-bye.